morning, everyone. Myself, Dr. Nitin from DKSH, and I welcome you all for today's Breast Cancer Awareness Talk. October is a Breast Cancer Awareness Month, and this month is extremely important because breast cancer is the commonest cancer in women in the whole world and in Singapore. The mortality because of breast cancer is also very high. In order to improve the breast cancer outcomes and survival, education and early detection is very, very critical. So today, in our breast cancer talk, we will first hear about Breast Cancer Foundation Singapore and their various initiatives. This will be followed by sharing by a breast cancer survivor. And after that, we will learn more about breast cancer from Dr. Lee Guek Eng. She's from Icon Cancer Center. You will also have an opportunity to ask questions after the final talk. And please remember to type your questions in the Q&A box. You can see the Q&A box is at the top right of your screen. You can click on that and type your questions. And once it is typed, please click submit. Our colleague Diana will facilitate the question and answers later. So with this, I would like to request our colleagues from Breast Cancer Foundation to start presenting. So over to you, Michelle.
Good morning. Good morning, and thank you so much, DKSH, for inviting all of us here today to share a little bit more about breast cancer, especially given that it is Breast Cancer Awareness Month. But really, the key message that we want everybody to take away with today is that to not only remember about breast cancer only in October, but really that breast cancer should be something that is important and in the forefront every day of our lives. Now, this is why we're all here today. Breast cancer incidences have been increasing very rapidly, and in the last 50 years, the numbers have actually tripled in Singapore. So the most recent statistic stands with 1 in 13 women in Singapore will develop breast cancer in their lifetime. Now, the good news is that 2 years ago, we did a survey and we asked both males and females in our community what they thought of breast cancer. So the good news is that actually 90% know of breast cancer to be dangerous. And in fact, even better than that, they know that breast checks are important. Now, unfortunately, this does not translate to action. And this is why the BCF, we go out so aggressively with outreach, because apart from just knowing about it and talking about it, we really need all the women in our lives to do their breast checks, and whether this is breast self-checks or mammograms. The numbers in Singapore are low compared to our Western counterparts. In Singapore, or less than 40% of women from 50 to 69 actually have their mammograms done. Now, the other question that a lot of people have, and in fact, this is something that I took for granted before I joined BCF. Oh, you know, breast cancer, I don't have to really think about it, you know. The people I know, most of them have it when they're much older. Unfortunately, that is a fallacy, because whilst the majority of women who get breast cancer are older, 1 in 6 women in Singapore of breast cancer cases are actually 45 and under. And Tricia, who will be sharing with us today, can share more about her personal experience as well as that of our members. And this is why it's so important to be vigilant. Breast cancer does not discriminate. And whilst, as with any cancer, we can't stop cancer, we can't, right? It's almost normalized in our lives. 50% of us will get some form of cancer in our lives. But with breast cancer, it is unfortunately or fortunately, a good cancer to get if you catch it early. So if you catch it stage 2 and under, we're talking about a fantastic 5-year survival rate of over 80%. Now, the risk factors, we're talking about age, family history, exposure to hormones, lifestyle. If you like, you can ask Dr. Lee more about this in detail later. Now, what I would like to stress, and I'm sure Dr. Lee will be sharing this with you as well, is that 90% of the women with breast cancer don't actually have a family history. Now, we hear of Angelina Jolie, the Angelina Jolie effect with the BRCA. So that's something that is quite familiar, or something that we've heard of, but the reality is that actually only 10% of women with breast cancer have a family history. And in fact, in Singapore, 70% don't even have risk factors. So we have a whole group, a very large group of women out there, myself falling into this group, where we think, well, we're young, we lead a fairly healthy lifestyle, we exercise, we eat well, we don't smoke, we only drink socially. We really don't have to be worrying about breast cancer or any form of cancer. Now, really, that is again a myth. Really, it can happen to anyone, and we really can't take our health for granted. There is a screening schedule on the right. And one thing, that I didn't know until I joined BCF is that we actually should be starting our breast self-checks when we turn 20, and mammograms 40 and above. I'm not going to go through the video today, but this is a step-by-step guide. I will share the link to the video in the chat later on. But again, if you have any questions regarding the BSE, Dr. Lee is here today, and you can please feel free to ask her more about that. A lot of people suffer from anxiety getting a mammogram. I had my first mammogram done last year. I personally suffered from some anxiety as well, because I heard it could be painful. What I did was that I threw a mammogram party. So I basically just joked some of my girlfriends, so a whole bunch of us went down and we had our mammograms done together. So really, if there is always a way to get around it. So again, if you are nervous about getting a mammogram done, talk about it, talk with your friends, let us know, and we'll try to sort you out there. So a little bit more about what we do at BCF. We are an IPC, we do have IPC status. What that means is that we are a registered charity. So for donations $20 and above, you do get a tax exemption. We have two baskets of work that we do. One is internal looking, which is basically taking care of our members. That means our breast cancer warriors, as well as their family. And then there is the outward looking, group of programs, which largely falls under education, awareness, and outreach, and that includes our mammogram subsidies. Now, I think many of you may not fall under this category, but if you do know of women who are financially stretched, especially during this COVID period, if you have a CHAS blue or orange card, you're 50 and above, you will actually qualify for free mammogram screening under our BEAM program. Call us or call any polyclinics to find out more about it. So there really is no financial obstacle to getting a mammogram done in Singapore. Some of the support group programs that we have, again, you can ask Trisha more about it. She is a huge advocate of and befriender, as well as she plays a huge part in our support group programs as well. How we differ from other cancer groups and healthcare groups is that ours is a peer-to-peer program. What that means is that instead of having a counselor or a psychologist do the counseling, we really call it a befriending program. So what happens is that we will profile match the patient as closely as possible to a befriender, and what will happen is that the befriender, having that shared experience, will walk together with you on your journey. And similarly, in our support group programs, they are largely facilitated and led by other breast cancer warriors. We also have a BEAT program, and therefore different stakeholders, including the survivors as well as their caregivers, as well as corporates. And what this does is that it is really a structured and formalized program. It's a little bit academic in nature, and it will equip you with skills again for the survivors to better help navigate their breast cancer journey. One thing I would like to highlight here is a WIC loan program that we have. Is currently suspended because of COVID, but nonetheless, do let us know if you know of anybody who needs this program. What happens is that with chemo, there is hair loss. When one-to-one personal consults. The patient comes in. The service is completely free. You just need to be a BCF member, and membership is also free. We also have a prosthesis program, but that has to be done through a medical social worker in one of the restructured hospitals. Now, some of these support services, now with COVID, everything's gone online. We used to have a monthly program on the second Saturday where we see everyone face to face. Now we do programs about twice a week virtually. Now, what I would like to highlight is that last year, we actually started a young women's support group because, again, young women do get breast cancer. And again, their concerns are very different. Tricia will be able to share more about that. And we also just last month started an advanced and metastatic group, support group online, because again, for ladies who are in the later stage, their treatment journey and what is, again, most important to them is very different, can be very different from the other warriors. Healing Through the Arts program is something which we've just started, actually restarted physically on site about 2 weeks ago. I'd just like to highlight that we do have a long list of programs. Go onto our Facebook and take a look. I'd just like to highlight that how this differs from your local community club really is that there is a therapeutic element in all of the classes that we conduct. So for instance, for dragon boating, now that's been actually medically proven to help with lymphedema, which is a common side effect from surgery if the lymph nodes from the armpit areas are removed. So in fact, that could help prevent or to manage lymphedema. Things like ukulele, when you use your fingers more with sewing as well, that actually helps with the nerves, and also sometimes with the chemotherapy there is numbness and a loss of feeling, and that helps with that as well. So on the outreach and education, we conduct talks such as this with DKSH. Pre-COVID, we also used to do live events, meaning on-site events, in wellness events with hospitals. Sometimes you see us at community clubs. Sometimes we do have standalone events as well. We do have memo bus deployments. We also work very closely with corporates with them, and sometimes we do have separate outreach programs with these corporates. They can also sometimes be internal fundraising drives. Sometimes we also have collaborations where the corporates support us through volunteers. So for instance, when we had walks previously, we used to need hundreds and hundreds of volunteers, and the corporates support us that way as well. Now, something that we launched just 2 months ago, and this is really something that I'm very proud of, is a booklet, and this is currently an app e-booklet. You can download it on the right. You just download the QR code. Whilst it is, I have to stress, it is a solid universal breast cancer guide. There is a focus on young women in Singapore and their journey, and in addition to that, aggressive breast cancer. So I'm sure Dr. Lee, specializing on young women, is definitely in a better position to share more about why it's even more important for young women to be vigilant about breast cancer, because they tend to get the more aggressive forms. Now, these are posters that I believe many of you might have seen in the HDB lift lobbies. This is our campaign for this year, our BCAM campaign for this year, and we've really brought in COVID into the conversation as well, because with COVID, everyone's just thinking about COVID and really ignoring their health. So whether it's about breast cancer screening or other forms of cancer screening, or even a regular health check screening, we seem to have forgotten about that, not willing to go into the polyclinics, or because we're not back in the office, the offices are not, or the businesses are not able to conduct their annual screenings as in the same manner. But we just really would like to send the message out there that our health screenings, all forms of health screenings, especially breast cancer, of course, remain important. Now, please, if you see the left QR code there, do download that. That will give you actually a step-by-step breast self-examination guide in the 4 main languages. And at the end of that, there is actually also a booking form for a mammogram at our local polyclinic. So please do download that. Our pink ribbon campaign continues to go out, so you have about 2 more weeks to grab your pink ribbons, which pins, which I'm wearing today. Some of the shops that you'll be able to see it include Famous Amos or the Estee Lauder counters or Sim. So please do support us. Again, I have to stress that our fundraising, we are a charity. We do rely on the generosity of the members of the public to support us. So please do help to support us by donating for a pin. We also have other online campaigns. So this is a Know Your Breast Challenge, which is really a tongue-in-cheek way of spreading more about breast cancer awareness, as well as using it as a platform for fundraising. So please do support us there. We also have merchandising this year. So you can go on to Lazada to grab these t-shirts. We also have mugs available actually just yesterday, and I haven't had a chance to update that. So again, there are mugs and t-shirts available this year. So this is my last slide. This is another collateral that we have. It's called the Breast Book. You can get this off our website, or you can download the QR code. In addition to all what I've shared earlier, this collateral also shares more about the types of breast cancer as well as the treatment options available. So this is really a very good one-stop shop to find out more about breast bone. This is also available in the 4 main languages. So do take a look and also do share it with your friends as well. Yep. So I've come to the end, and I will then pass it on to Trisha, I believe. Right?
Yeah, Trisha, can you please start presenting? Thank you.
Okay. Thank you, Michelle. Just a sec. Hello, everybody. My name is Trisha, and thank you very much for inviting me, for me to have a chance to share my story. And I've been a Breast Cancer Foundation volunteer for more than a decade. So I think longer than Michelle, probably. And so I thought I'll just share a little bit the face behind the pink ribbons and behind those campaigns and the real person story. And hopefully there's something that what cancer have taught me, some of the life's lessons, I hope to share it with you. All right, let's start. So I'm going to go through some of the life lessons such as impermanence, enjoy the journey, balance, and gratitude. So hopefully it can inspire you in some way that is beyond just a story, it's a survivor story. Okay, so I was diagnosed fairly early at 32 years old. Just when I'm planning career, family planning, I had my baby, she's 9 months old at that time when I was diagnosed, and I have a 4-year-old son. And so everything just took a detour. So this is something that cancer taught me, that impermanence. So a lot of things like when something happens, we have to just deal with it as it comes along. So I went for treatments, I had chemotherapy, radiotherapy, surgery, mastectomy, and reconstruction. And there is pain for sure, and there is hair loss. But all those things, I tell myself that it's not going to be there forever. And I find it very helpful to remember that all those things are not permanent. And it also taught me to really make the most of everything that comes my way and really live fully, even with the diagnosis. So my favorite quote at that time and even till now is, "In time, this too shall pass." So just like how COVID is with us right now, initially we're like, whoa, but then, and then so COVID and cancer, in a way, it's not welcomed. It comes, it goes. So we just deal with it as along the way. So when we are diagnosed, we want to have the acceptance first. And then with the awareness, okay, I've accepted my cancer diagnosis. What next, right? So it comes with the awareness, and then I want to take action. So the reason why I put enjoy the journey is, so once I know that I already have cancer, then what? When people tell me, oh, Trisha, you can't eat this, no, you can't eat that, then I'll be curious, why? why? What is good? What is it that why I can't eat this product? Why I cannot eat chicken? Why no soy? You know, so then I was like getting curious. I started learning more about it, and instead of just blindly following. So this is helpful if you are a caregiver or you have friends and family who are diagnosed with cancer. Just find out why. What type of exercise does my body need? What can it handle? How do I boost my immune system? And I continue to learn through the many survivors that I met through Breast Cancer Foundation. I learned like meditation to calm my monkey mind. And sometimes with cancer, we just like stay awake at night and then think this, think that, oh my God, is this going to happen? And that's not helpful at all. So I find that learning some coping technique to help ourselves is important. And I took up a lot of courses to help understand the human mind. Why we think that, why we always have all those worst case scenario in our head. And I find that, and then somehow it led me to a new career as a coach, as a life coach. So so all those things is because of the attitude. I decided that in spite of cancer, I want to enjoy the journey. And this is why I adjusted accordingly along the way. And I think that is something that cancer have taught me too. And even with an unexpected journey, it can bring surprises and learn to admire what's along the way. So I aspire to inspire before I expire. So that's one of my mantra. Balance. So cancer taught me that a lot of things is all about balance. So we want to be mindful of our action, our thoughts, and our choices. So when somebody says diet, right? So we don't want to be too extreme. Oh, I totally turned vegetarian. I'm not going to eat meat again. No, that's on the extreme end. So we want to be mindful about what we eat because we want to balance. Our body needs that. And even stress, we can't say that, oh no, I don't want any stress at all. No, some bit of stress is good, but we don't want to be too much of a stress, too sad, too happy. Two extremes are no good. So always keep in mind, when something is not right for you, ask yourself, what is off balance? Is it because I partied too much last night? Is it because I ate too much? I ate buffet, so that's why I'm not feeling so well today. So we want to strike that balance. So even sleeping too much is no good. Enough to recharge our human battery. I always say it's our human battery. So we just want to have enough of everything. And just like riding a bicycle, balancing, we just keep moving. Just keep moving, keep ourselves on our toes and keep moving. So that's a good way to remember that in life, you will notice that a lot of things is about balance. So what is out of balance, look for it and then try to rebalance it again. The fourth life lesson that cancer taught me was gratitude. So what are you grateful for? I am grateful that I did my self-check early enough and found the lump because I found it at 32. So like Michelle have indicated earlier, I was too young to be doing mammogram at that time. But I happened to do a self-check and I found a lump early, so it was good. And I'm also thankful for the good medical system in Singapore and support resources like Breast Cancer Foundation, where they have support groups. We meet like-minded survivors and learn from them too. I'm also grateful that I bought medical insurance that cover a lot of the expensive expenses. I might come across like an insurance agent, but I'm not. I just feel that a lot of women that I've spoken with, some of them, other than the shock of being diagnosed with breast cancer, they are also shocked by the amount of money that's involved for the medical treatment. So having adequate insurance is helpful. And I'm also grateful that I have supportive family and friends throughout this journey, and also grateful for a lot of new possibilities to learn, yeah, just like how COVID is for, I think many of you guys can relate. COVID, even though a lot of us don't like it, but it also brought a lot of new possibilities. Now that we can connect through Zoom and learning through in the comfort of probably some of you at home. So these are all new possibilities that so-called a crisis brought. And so we just have to look around us and ask ourselves, what can we be grateful for? All the little things in life. And I just want to add also, sometimes we forget how precious it is just to be alive. And self-care is really, really important. I can't emphasize enough. It's like, so going for checks and all this is part and parcel of self-care. We don't want to wait until cancer comes for it to be your teacher. So we want to build up our immunity to make sure that our emotional bank is as healthy level as our financial bank. So just like COVID, if your immunity is stronger, the chances of you getting COVID is less. So it's the same thing with cancer. So we want to make sure that emotionally, physically, financially, we are all on the good side, so that whatever comes along, we are in a good space to handle. And I hope that through my stories and through some of the life lessons that cancer have taught me, it will inspire you in some way in your life, or not just specifically for cancer. And you can also share those stories with somebody that you're caring for who's affected by cancer. So different seasons, there are different reasons. So just embrace it as it comes. And I guess change is the only constant for us, and always ask ourselves, what are we grateful for? And with this, I end my sharing. And cancer can only take away my hair, but not my smile and attitude. So this was me when I was newly diagnosed, undergoing chemotherapy. So I lost all my hair, but my friends and I decided to throw a pink party. So everything, we want to be in the pink of health. So everything was pink, pink, pink. The food was pink. My clothing was pink, except my son. He refused to wear anything pink. So there he is in blue. So that's it for my presentation. And again, my name is Tricia Pang. And let me just stop my sharing for now. And there we go. Thank you for listening. So, okay.
Thanks, Tricia. Thank you so much. And
thank you so much. Yeah.
Thanks for sharing your story, and really inspiring for all of us. And it's very important to stay positive and stay strong. That's how, what we learn. And one thing which I really, noticed, we should learn, how to stay positive, and we should value the life, what we have right now. Yeah. So
and we don't want to do it only during that time. I think it's good to have to build out our emotional bank, especially times like this, just to have it. It's just like the money, right? A financial bank. We save up, but we need to save up on the good stuff, and so it becomes a habit. It becomes a part and parcel. So whatever comes along, we are able to deal with it. Whether it's health issue crisis, whether it's financial crisis, job crisis, whatever comes along, I think we will have the mental capacity to deal with it. Yeah.
Yeah, thank you so much. So with this, thank you. And I would like to introduce Dr. Lee Guek Eng. So let me start presenting from my slide. So we have a third presenter, Dr. Lee Guek Eng. Dr. Lee graduated from National University of Singapore with a Bachelor's of Medicine and Bachelor of Surgery, after having obtained a Bachelor of Science in Cell and Molecular Biology. So she completed her medical oncology specialist training in 2013 and went on to practice medical oncology at National Cancer Center, Singapore. Dr. Lee specializes in breast cancer, specifically focusing on young women with breast cancer and research. For her work in breast cancer, she was awarded International Fellowship NMRC Research Grant in 2016 to train as a fellow at Dana-Farber Cancer Institute, focusing on young women with breast cancer and pregnancy-associated breast cancer. Dr. Lee has a strong focus on research and has been involved in a number of Singapore studies, including identifying the barriers to trial population amongst the Asian population and young women with breast cancer. She was involved in a setting up national program for young women with breast cancer to help increase awareness and education. She was also awarded a second grant under the Industry Alignment Fund by NMRC for her research in a novel compound for treatment for brain metastases in advanced breast cancer patients. She represented Singapore in numerous overseas international oncology conferences and presented her research, her work extensively over the last years. So with this, Dr. Lee, over to you.
Thank you. Let me just open up my deck. So thank you, Tricia, for the very inspiring sharing. I really appreciate that. And thank you for the introduction. So, this month is October, so we are into the decade. So we have to focus on breast cancer and how to protect ourselves. And I think to echo what the previous two speakers spoke on, I think even for young women, it's very important to be vigilant and to take care of yourself and to do breast self-examination. I can't stress that enough. So let's move on. So Dr. Nitin has already kindly introduced me. Basically, my interest is in female cancers, mainly in breast cancers, and I do a lot of work on young women with breast cancer. So in fact, when I trained in Dana-Farber Cancer Institute, Dana-Farber was the first institute in US that actually came up with their young women cancer program. So having come back from the traineeship, I set up a young women cancer program, which is also the first in Singapore in Icon Cancer Center now. And I think it's a very important initiative, just like what DCF has done to set up a young women support group. I think it's very timely, and there are more and more young women with breast cancer. So these programs are all in good time. So just to say, talk about the scope of this presentation. So today I will just touch on the burden of breast cancer, symptoms, risk factors, breast cancer in young women, and also a little bit about fertility preservation. And then I will move on and finish up with facts and myths. So with that, I will move on to the burden of cancer in Singapore. If we look at the graph, I think because it's a BCAN month, I think everyone must have heard some breast cancer talk, and this graph is not unfamiliar to most of us. We can see that, looking at the pink line, the incidence of breast cancer in Singapore has really increased tremendously. If we compare like 70s to now, this number has actually tripled. But I think we don't just want to focus on the bad news. If we look at the cancer mortality rate, we do see that the cancer mortality rate is actually more or less stable, and that is reflected in the graph below. And the reason being, I would like to say that it must be in part due to breast cancer screening, because breast cancer screening essentially helps to tease out, early cancer, which can then be fully cured. I think before we move on further, let's talk about what are the common breast cancers. Most of the time, when we talk about breast cancer, we just know that the cancer arises from the anterior part of the chest, but exactly where we may not know. So if we look at the structure, we can see that the breast is made up of a few structures like the muscle, the fats, the connective tissues, the lobules that makes up the milk, and also the ducts that convey the milk from the lobules to the nipple. So the most common cancer actually arises from the ducts that convey the milk from the lobules to the nipple. It's called invasive ductal carcinoma, and it makes up for about 70% of the cancer incidence. The rest, probably about 20–30%, they are composed of invasive lobular carcinoma, which comes from the lobules. Maybe about less than 5% will belong to the rarer subtype. So we focus really on ductal carcinoma and lobular carcinoma, which together they make up for more than 90% of the breast cancer subtype. So what are the common symptoms? I think just now Michelle probably went through them briefly. So indeed, the most common symptoms are breast lump in the armpit, even changes in the shape or symmetry of the breast, or persistent skin changes, or even like frank nipple discharges or bleeding or nipple retraction or even pain. However, if you don't do your breast self-examination, you will not find all this. It's like taking, a lesson from Tricia's story. If she didn't do the breast self-examination when she was 32, she might have missed the diagnosis. So having said that, even though these symptoms can prompt you to be alert and to seek medical advice, not all of these symptoms are associated with cancer. They could be associated with just benign breast disease. So the take-home message will be, if you find something new and something that is persistent, do seek medical advice early. So next, we want to talk about risk factors associated with breast cancer, mainly because we want to know what we can actively do to change them and to improve, our risk profile. So usually for risk factors, I like to dichotomize it into modifiable and non-modifiable. Of course, what we want to do is to act on the modifiable. We can't do anything about the non-modifiable, unfortunately. So what are the modifiable risk factors? They include sedentary lifestyle, obesity, alcohol consumption, smoking, taking hormones in the form of hormone replacement therapy, or certain types of oral contraceptive pills. So the non-modifiable risk factors include being female, something we can't change, and aging, we can't change that, but we can age gracefully while, staying vigilant about our body and go for regular screening. So race, certain race, and of course a strong family history can predispose to getting breast cancer. Early menarche, meaning early start of menstruation, late menopause, because it really exposes our body to female hormones. And this is the same reason for delayed or no childbearing, because when we have no childbearing, we don't interrupt the menstrual cycle. So overall, the exposure of the body to female hormone is relatively higher. And for some patients, like women or men, they may have childhood disease, so that requires chest irradiation. So this will then predispose them to getting cancer at a much later age. What can we do? I think I can't stress this enough. We really need to lead a healthy lifestyle. We should consider exercising on a regular basis. Try not to drink, or at least cut down on drinking alcohol. Quit smoking and keeping a healthy weight. So what does WHO recommend? WHO really recommends that we do at least 150 minutes a week of moderate intensity aerobic exercise and 2 times a week of muscle strengthening exercise. I think it's easy to say it. It's not that easy. Even I have problem adhering to this, but I do try to exercise, like 5 to 6 times a week. But if we divide 150 minutes into like 5, then we need to do at least 30 minutes 5 times a week, which is quite a difficult goal, considering that it's moderate intensity exercise we are talking about. So, not just like shopping in a mall, we need to get our heart going, pumping, and sweat it out. That's considered exercise. So how to make it easier? I mean, the way I see it, we should do something we really like. And look at this. I mean, I'm into hiking, so this is a really good hike that I had like last year before COVID. This is the Mont Blanc tour. So essentially, it's a hike that comprises 3 countries. So we crosses the Italy, France, Switzerland borders. So we did this hike over 7 days, and we were rewarded with the lovely views. So the way I look at it, if you want to do something consistent and not so easy, maybe it's easier to do it with someone you like, a good company, or good company is like the happy group there. So we were all like euphoric from the hike. I think easier to find a good company, then like slowly transit from walking to hiking to running, or even just other activities like tennis, badminton, and all that. So coming to this, like American Institute for Cancer Research on cancer prevention recommendation, I think most of this are what we have spoken about just now. Be physically active, eat a diet rich in whole grain, vegetables, fruit, and beans. Try to limit red processed meat, fast food. Limit consumption of sugar. I will touch on this later, again in the myth and fact section. And of course, limit alcohol. Do not use supplement. Mainly, they are talking about do not overuse supplement and do not take too much supplements, basically. And also, okay, so for this one, so I'll just move this up. So of course, for mothers, try to breastfeed, and for cancer survivor, follow a surveillance plan, like for, sorry, for breast cancer survivors, you have to go for your yearly mammogram, go for it, don't skip it. So this is what they mean. Okay. So really, I think this has been repeated again and again. Try not to miss the breast cancer screening. We do have a national program for screening. So for women above 50 years of age, once every 2 years, between 40 to 49, once a year. For younger women who has a significant family history or even personal risk, they may need to be screened at an even earlier age. So it's really case by case. So do talk to your oncologist or your doctor. And it really involves mammogram. So what is mammogram? It's actually an X-ray picture of the breast. So a lot of people, like what Michelle said, may complain that it's painful, etc. But really, it depends on individual and each of us, our pain threshold, right? So likewise, I've gone for mammogram, and to me, it's not really painful. It may be uncomfortable, but it is generally a very fast procedure. Some tips: try not to arrange for mammogram before or during your period because your breast can be very tender or sensitive. Try not to wear perfume or deodorant because you do not want to have to repeat it because the chemicals can affect the image. So why is this topic important? Let's switch gear to this young women with breast cancer. And by young, different countries have different definitions. Some country may have definition below 50, some has definition below 45. But generally, we are referring to age 40 and below. So I think it's easier to appreciate this number in Singapore, especially if we compare it to the Western population. In Western population, the proportion of breast cancer below 40 years is probably about 4 to 7%. But in Asia, this number is much higher. In Singapore alone, if we look at the population below 44 years of age, we are looking at 18-19% of breast cancer population. And this is really quite significant when we have another number to contrast it to, you see. The general treatment principles do not differ. It still really depends on the biology of the disease, the subtype of the disease. But in this talk, I will not go into treatment per se. And so we'll just talk about the general challenges and psychosocial issues. So why do we have to put this group of patients in a different category? I think mainly because we have to consider numerous psychosocial issues that young women may face. So what are some of the psychosocial issues? Basically, they are young, like they may be starting their career, they may be juggling young families, or they may not have started their family because more and more women are postponing marriage and childbirth. So a lot of times, I see a lot of young women with the breast cancer diagnosis, and most of the time, when they see me with the diagnosis, they have not even completed their family. So this is an added stress. And of course, when we talk about peer pressures, their peers may be at a different point in their life, and hence all this can contribute to them having issues with their sexuality, fertility, relationship issues when they compare with their peers. And also the treatment may cause them to have body image or even self-image issues. And all this together can affect their adherence and compliance to treatment. So of course, the final two medical things that we have to consider for them is fertility preservation, as well as hereditary disease possibility. And next, I'll just talk a little bit about how they respond to treatment and how their body can respond differently. So basically, when we talk about hormonal treatment in young women, usually it involves some degree of suppressing the female hormones. And for the younger women, like less than 35 years who are hormone positive, we may even advocate ovarian suppression. That means suppressing the ovary and then rendering the estradiol to very, very low level. Basically, they are menopause. So for these young women, they may have more side effects because imagine their hormone drives are much higher than their older counterpart, and suddenly you are shutting them down, right? So sometimes they can get a lot of hormonal endocrine side effects like hot flushes, mood change, depression, insomnia, weight gain, which then affect their body image issues, osteoporosis, etc. So they do have all this, side effects from treatment. They have to grapple with these side effects as well. At the same time, considering, finances, employment, and if they have young kids, taking care of a young family. So all these are, potential source of stress, and added together, it can be very overwhelming. So why is fertility preservation important? First of all, for these young women, like what I mentioned, by the time they get a breast cancer diagnosis, they may not have completed their family. So it's really important because, also they have, with improved survival now, like we can have a 5-year survival rate for stage 1 cancer of up to 90%. We are talking about, this patient surviving for longer and longer. And if they're young, they really have years ahead of them. And we want them to have good quality of life after a breast cancer diagnosis and treatment. And we want them to be able to pick up their lives from before diagnosis. They are able to look forward to a fulfilling life of getting married and having kids. So that's why fertility preservation is very important. So when we see a young woman, what happens is that we really have to establish if their family planning is completed. So we really need to ask a lot of questions, like personal questions. And sometimes we need to send them to a gynecologist or obstetrician for them to get a thorough assessment. And some of the common questions that they usually ask will be, can I check my fertility level before treatment? Will my age affect my fertility? What are my chances of getting pregnant after treatment? And how can I try to preserve fertility and still have childbearing after the treatment? So fertility 101, I think just some background. Women are born with a fixed number of eggs, and this number really do decline, including the quality of the eggs. So by the time menopause sets in, about 50 years of age, the ovaries really stop releasing the eggs. So when we talk about likelihood of subfertility with a breast cancer treatment, we have to consider what are the types of drugs used, what is the dose, the current age of diagnosis, and what was the fertility level before treatment. And we have to consider the fertility treatment before even starting the systemic treatment. A lot of women may, decide that, no, this is not for me because it's going to delay my treatment. I just want to get the treatment done. It's not uncommon because usually when they are diagnosed and they have a lot of information being thrown at them and they just want to get on with treatment, they will be very overwhelmed. So we usually need to sit them down and talk to them, maybe get them to really see themselves outside the current situation, to think about their future, because once the systemic treatment is done, the damage is done. It's not that easily salvageable. And with modern technique, usually fertility preservation can be done within 2 to 3 weeks. And sometimes you need even 2 to 3 weeks to get all the investigations, the core biopsy, to analyze the result and to plan what to do. So basically what I'm trying to say is that with modern techniques, the fertility treatment is no longer a lengthy treatment that requires us to postpone the systemic treatment to an extent that can affect the outcome. So it's not that. So what are some of the common fertility preservation techniques? So in Singapore, our gold standard is always embryo cryopreservation or oocyte cryopreservation. But by Singapore law, embryo cryopreservations can only be done for legally married couple. Other methods include ovarian tissue preservation or even ovarian suppression, even though this is not the gold standard. It's one of the options if the patient cannot go ahead to do the embryo cryopreservation or oocyte cryopreservation. So lastly, we can't, not talk about the Angelina effect when we talk about young women with breast cancer. So when a young woman is diagnosed, of course, there is a possibility of BRCA1/2 mutation, and that basically that predisposes them to hereditary condition that predispose them to get breast cancer. So not all young women will have a BRCA1/2 mutation. In fact, the percentage of BRCA1/2 mutation is not high, it's probably 5 to 10%. But for any young women, there's always a chance, and the chance is higher than their older counterpart. So they have to consider getting genetic testing for that. It is not a must, but they need to go through a pre-test counseling to know the pros and cons before making the decision. And after the testing, they will still need a post-test counseling and to talk about risk-reducing surgeries. So this cartoon really illustrates that the discussion is not a simple one. It usually, happen over multiple consults. So in our cancer center, we do recognize that, younger women, they are a unique group, and when they are diagnosed with breast cancer or even other cancer, they really have to navigate through, issues like psychosocial issues, fertility issues, medical, financial issues. Hence, we have set up a young women cancer program specifically to target all these issues, to navigate through this in a step-by-step way, while ensuring that they get timely treatment for their cancer. So lastly, I just want to touch a little bit on breast cancer myth. I think the two speakers has probably already mentioned a little bit. A few of these myths are due to a false sense of security. Like some women may feel that, only older women are at risk, or as long as I exercise and lead a healthy lifestyle, I don't have to worry, or even as long as I go for regular mammogram, I'm safe. But all this basically just reduce the risk, but doesn't eliminate it. I think we still have to be very vigilant. We still have to do our regular self-breast examination to ensure that we pick up any changes in a timely fashion. The last point I want to touch on is consuming too much sugar. So you may see, on the web, a lot of articles saying that sugar can feed cancer, etc. But I just want to clarify, sugar doesn't cause the cancer directly. In an indirect way, if anyone who eats too much sugar can lead to obesity. And obesity is then a risk factor for breast cancer. So they are not directly linked, but indirectly, basically, obesity, increased fat, all this can increase risk to breast or even colon cancer. So with that, I want to urge all of us to stay safe, stay vigilant, do regular breast self-examination, and of course, stay positive. So with that, thank you. I finished my talk, and I'm happy to take any questions.
Thank you so much, Dr. Lee. Thank you so much for your presentation. It was very informative, and I'm sure our audience have learned a lot from you. So I will request Diana to take a few questions. So over to you, Diana.
Okay, Dr. Lee, we have a few questions. First is one. Someone asked, as a cancer patient, how do you search for reliable information, because there are so much information and misinformation on the internet? See, where is a place good for searching and doing research?
Okay, so I'll take that. So usually, when you do Google search, I would advocate for most of us, if we are looking for medical information, we should go to, sites recommended, government sites, government linked sites, UK Cancer Research has a very good site that has a lot of information on cancer. In fact, AACR, the American Cancer Research, also has a lot of information on cancer research as well as basic information on cancer. So I would say go for the legitimate sites.
Thank you, Dr. Lee. There's another question. Just now you have mentioned about the Angelina Jolie effect. There's a question on that part, and the question asking, would you recommend genetic screening for BRCA and HER2 and maybe other biomarkers to become a more routine screening rather than just mammograms yearly?
Well, I think that question is really quite a complex one because HER2 is actually a type of receptor subtype, right? It determines, it's not only prognostic, it's predictive, meaning it predicts response to like treatment. So for HER2, etc., we do it on a routine basis for breast cancer patients because that really helps to guide treatment. So for a patient who is HER2 positive, then they will be treated with anti-HER2 therapy. So we know that because it's prognostic, it tells us, whether the disease do well or don't do as well. It's predictive because it predicts whether the treatment is useful. So that's for the HER2 biomarker. However, when we talk about genetic screening for like BRCA1 or 2, it really boils down to at this point, we only screen patients with index case, meaning they have the breast cancer and they have a significant history. The reason being, all these tests is not so easy because you see, before the test, we still have to consider pre-test counseling. After the test, we have to consider post-test counseling. The reason why we advocate all this counseling is because it's not just a test result. It's a test result that has a lot of implication. So for example, if you are tested positive, then you have to worry, how about, can I still buy insurance? How about my children? How about my siblings? How about my sister? So all this can have impact on your family member, on insurance, on even, employment. So when you go for interviews and all that, you have to submit your medical history and all that. So in US, there is a GINA code that prevents discrimination for people who are screened positive. Well, Singapore is not at that stage yet, but of course, it doesn't stop us from working towards that state, right? So at this point in Singapore, it does have a lot of implications, not only for yourself, but also for your immediate family members or even your relatives, you see, first-degree relative. So it's not a simple, just do it. You have to consider all this implication. So if there are so many issues to consider, how can it be for the general population? Cannot.
There's another question. What are the chances of survival should one be diagnosed with breast cancer? I think this is quite a general question. Yeah.
Yeah. So when you talk about survival rate for breast cancer, I mean, it really depends on the stage. So we have stage 1, 2, 3, 4. For stage 4 disease, even though it's not curable, but we do have patients. First of all, it's highly treatable. We have a lot of drugs now for treatment of stage 4 cancer. So that's one thing. And the second thing is that we have a lot of long-term survivors, people surviving for up to 5 years, 10 years, even with stage 4 cancer. It really depends and boils down to the subtype of the cancer. For the treatable ones, like stage 1 to 3 cancer, then the survival really depends on which stage. Like just now what I mentioned, for stage 1, we are talking about a 5-year survival rate of 90%, stage 2 probably 80%, stage 3 we are talking about usually 60-70%. So I would say, over the years, with all the invention of newer drugs, we are really seeing a higher and higher number, which is a really good thing.
There's another question mentioning about sugar intake and obesity. Just now you have actually gone through with us about the myth and that of sugar intake and obesity, but the question I believe is why do women who are obese have a higher chance of getting breast cancer?
So, actually, fats in our body, it does produce hormones, you see. So even in studies done for breast cancer survivors, studies have done and shown, and they dichotomized and they did a subset analysis. The women with a higher BMI who are associated with obesity, they tend to do much worse in terms of breast cancer outcome. So basically, our female fat cells produces hormones. So can't stress enough to do exercise, to lead a healthy lifestyle, and keep within a good BMI.
Totally, Cheryl has a question on breastfeeding. So she asked, will prolonged breastfeeding, like say beyond 6 months, reduce the risk of breast cancer?
So breastfeeding is shown to have a positive effect to reduce the risk of breast cancer. Usually we are talking about, substantial length of time. So if you're asking like 6 months enough, then yes, it is. The recommendation is 6 months to a year. However, I don't think that is, at least not to my knowledge, that breastfeeding beyond 1 year, like with increasing number of years, it improves the outcome very much. Anyway, it's not exactly practical to breastfeed for that long, right? Especially in Singapore, where we have to go back to work.
I actually breastfed over a year, so for my first son, and then my daughter over 6 months. So I wouldn't say that use breastfeeding only as an insurance against breast cancer. I would still think that it's important to do self-check, because at that time it was thought that it was a blocked milk duct that was causing it, the lump, which I've also heard from our young women support group. Actually, quite many of them do breastfeed, and they also suspected it was a blocked milk duct that instead of cancer. So we never even connected that, because we thought, okay, because we breastfed, we are okay. So that could also be a false security. Yeah, so it's important to note that lah. Of course, it's good to breastfeed. I mean, more for the bonding part and all the goodies and stuff like that. But in general, I think we just want to say that, be aware that it's not, because, like I think just now the slide shows 70% of us did not have any of those factors. And it's important to note that, because many will not check because they will think that I eat healthy, I exercise, I breastfed, I have all the check marks, so I wouldn't have breast cancer. So that's a false assumption, because I would say maybe out of 10 women I meet, maybe 8 of them fall into that category. And so it's good to know lah. Yeah.
So Dr. Lee, there's another question from Irene. She asked if one person has a breast cancer, does it increase the risk to get other types of cancer? If so, which are the more common ones?
Well, I mean, if you have an isolated case of cancer and you don't have any hereditary disease syndrome, as in, like, for example, like BRCA1 and BRCA2, they actually predispose you to basically a spectrum of cancers, not only just breast, but ovarian, and even in male, you can get pancreatic or prostate cancer. So basically, it's related to a hereditary disease syndrome. So if you just get breast cancer and you are not tested positive for the disease syndrome, then it's very unlikely for you to get other cancer. However, if you have breast cancer, that is a risk factor for you to get future breast cancer, which is why, we still treat and we try to reduce recurrence with adjuvant treatment. So for hormone positive disease, we treat with 5 to 10 years of hormone treatment. And for like hormone negative or HER2 positive, we treat with targeted treatment and chemotherapy.
There's just one last question that we have here. So the person asked if will she have a high risk of any cancer as a family member has a history of pancreatic cancer. So could it be the person would get pancreatic cancer or any other type of cancer?
really requires a detailed study of the family history. I mean, it's not just enough to know of one other person with pancreatic cancer. We need to draw out the family tree, and we usually need to draw a tree layer, meaning like your not only, so you need to involve your immediate offspring, and then your parents and your grandparents, and then we need to know at what age does the index person has the pancreatic cancer, and then we need to look and study what other cancers are evident in the family tree before we can actually make the call or make the advice for testing or not.
So one final question, Dr. Lee, is about the self-breast, the monthly check. So how do we detect the risk, the breast cancer? How does the lump actually feel like?
So for different people, it's very individual. For different people, the lump will feel differently. It can be hard for some, it can be soft, and then it can be immobile for some, and then it can be, quite fixed for some. So very difficult to explain. But if you detect a lump, any lump, and if it's something new, you need to seek medical advice. So just to mention how to do it properly, I think just now Michelle had a slide, right? I think it's very good. Just ensure, every quadrant, every part, you can feel it. There are two areas that are commonly missed. That is under the armpit as well as under the nipple, because it's very difficult to feel under the nipple. So what you need is to really fix one side and then, just dig your hand under the nipple to feel it. It's not comfortable, but just try to do it, you see. And one other tip is to do it at a fixed time every month, because if you do it, like sometimes if you do it before menses and then sometimes you do it after your menses, it can feel really different. Like for a lot of women before menses, they get very lumpy breasts. So my advice is always, do it after the menses and have a fixed time. So maybe, if you consider the start of your menses as day 1, then you can choose to do it maybe at day 5. That's when, all the, some people can get very edematous and then fluid retention and all that. So usually when you're at like maybe day 3, 4, 5, the fluids will start to come off, and then you'll feel like lighter. So I think that's when also your breast will feel like, less tender, less lumpy, easier to feel for menses. So if you do it at a regular time interval. Do it like every month at day 5 of your menses. So that will help.
And if I can just jump in here as well, Dr. Lee, another part that sometimes the ladies don't realize is actually the chest area that you imagine is above your breast. So they don't think, and we've seen again members who have had lumps that are actually high up. And it's just that in our minds as females, when we say breast, we always just think in a very localized fashion of what sticks out, where actually, the part that's above where it sticks out, beyond where it sticks out, is actually also constitutes as part of the breast area. So even the part where you think it's flat and bony, if you do get lumps there as well, it should be checked. Yeah.
Right. All the answers. Thank you, Michelle. Thank you, Tricia. We have come to the end of today's session. It was very informative. I believe that all the attendees have benefited a lot from this session. So once again, I'd like to thank you everyone for your time this afternoon. So have a great day ahead. Thank you very much and see you next time. Goodbye.